article for this week is titled as Endodontic Bulb Revitalization in Traumatized Necrotic Immature Permanent Incisors, Early Failures and Long-Term Outcomes, a longitudinal cohort study that is done by Elina Wikstrom and colleagues. They are a group from Umeå University, Sweden. The paper it is published in International Endodontic Journal in 2022. So to start with, trauma is the main reason for pulp necrosis in immature permanent incisors. When severe dental trauma injuries such as avulsion or intrusive luxation are present, it may in the long term cause ankylosis and risk for early tooth extraction. In the recent years, much effort has been made to find an alternative to conventional endodontic treatment, since it does not lead to further root formation, leaving the tooth fragile and susceptible to root fracture. Regenerative endodontic treatment, also called pulp revitalization (PR), has been proposed as an alternative to conventional treatment technique, such as the abexification technique with multiple application of calcium hydroxide or MTA apical plug technique. In this study, they aim to evaluate the clinical and radiographical outcome of traumatized permanent incisors treated with PR with a follow-up of at least 24 months, and the participants were referred to specialist clinic in endodontic and pediatric dentistry at the Eastman Institute, Stockholm, Sweden, and to the Department of Endodontic at Umeå University. They included patients aged between 6 to 22 years who presented with a traumatized permanent incisor with open apex greater than 1 mm and with a root development stage 1 to 4, diagnosed as necrotic pulp and or apical periodontitis, no history of endodontic treatment, bulb space not needed for post or core restoration, and adequate coronal restoration with no signs of caries. They defined success as successfully completed PR cases without any clinical symptoms, which included no pain, sinus tract, swelling, or sensitivity on palpation or percussion, with radiographic signs of healing of apical periodontitis, as well as evidence of continued root development. Failure was defined as the presence of clinical symptoms after the completion of the PR, and the radiographic signs defined as failure were persisting apical periodontitis, the absence of continued root formation in length and width, or no apex closure. All were assessed at the final follow-up visits. They initially started with 82 teeth, 7 were excluded due to lack of compliance. They ended up with 75 teeth for revitalization. 56 pulp revitalization performed successfully. However, 19 teeth in the second visit did not receive pulp revitalization due to lack of bleeding and MTA abexification performed. Regarding the cases that received pulp revitalization upon follow-up with a minimum period of 2 years, 45 were successful and 11 failed. These failed cases were characterized by severe trauma, and the following outcomes were observed: ankylosis with signs of infraposition, persisting apical periodontitis, and clinical symptoms or no signs of continued root development nor apex closure. Pathological periodontal pocket has been reported in some of the failed cases, and apical marginal communication with mobility grade 3. Also, as the main objective of the PR is to achieve continued root maturation, they wanted to predict which variables are influential in this contest, and it was demonstrated that several variables had a statistically significant impact on continued root maturation, where 3 predictive variables were identified. These variables included root development stage at entry, trauma to soft tissues, and preoperative dentine wall thickness. Their findings indicate that the lower preoperative root development stage, the more maturation at each level of increase of the root development stage. But the post-operative dentine wall thickness remained lower. So in conclusion, PR was successful in 60% of the cases. Two predictive variables for continued root maturation were identified: root development stage at entry and preoperative dentine wall thickness. The PR failure was related to lack of bleeding and persistent infections, which indicate that new techniques are needed to improve the predictability of pulp revitalization.